Number of people being tested for COVID-19 across the state is increasing, and so are the number of children being tested.
Doctors are learning more about how the coronavirus impacts children. WPTV News Channel 5's Michelle Casada explains what every parent needs to know.
Parents should not be fearful, but need to be educated. We've seen how COVID-19 can impact adults differently, and the same is true for children. If you ask Shannon Meager and her 10-year-old son Liam how long they have been quarantined,
we've been quarantined a long time. Yeah.
Recently, Liam started experiencing COVID-19 symptoms, but they were mild. Some coughing, sore throat, and a runny nose.
Just because the mama bear instincts kicked in, there was something, let me just go get him tested.
The test came back positive, but Shannon, who says she hasn't been separated from her son, tested negative. In fact, none of the adults around him tested positive. Found Care Chief Medical Officer and pediatrician Dr. Onika Marriott says there is still ongoing research on kids and the coronavirus, but there are some theories being explored.
Maybe kids aren't transmitting it, that they may be what we call N vectors for the disease. So they get it, but they're not necessarily transmitting it.
Dr. Marriott says COVID-19 symptoms are appearing to be more mild in children than adults, but parents should still be cautious. Palm Beach County Health Department Director Dr. Alina Alonso says the more testing that happens, the more they understand who is being impacted.
Because we now know that children can get severely ill with the virus, and we now know that children under the age of 18 have died with the virus, and we also know that children under the age of 18 can also have this multi-inflammatory system syndrome, is that if your child is sick, please get them tested.
Michelle Casada, WPTV News Channel 5.